All right, welcome to the podcast, everybody. Today, I want to take a subject that has been in and out of the news a lot, and anybody that follows sports or saw the amazing movie with Will Smith in it, Concussion, I think is going to enjoy today's summary here. So the topic is concussion. And, having been athletic in my life and having been just a general kind of crazy boy jumping bikes over ramps, I've sustained concussions. And back in the 70s when that happened, they kind of just told you to go to bed and you hopefully woke up in the morning. Today, obviously, we have a much more sophisticated, thank God, system for categorization and symptomatic analysis. And so I've done some research to put together something, and I want to get into some of the treatments as well, some basic herbal and vitamin, physical, movements, things that can enhance brain function and brain healing. We've done topics in the past on brain balance, which I think is interesting too. I won't get into that today, but brain balancing exercises are also very good for patients that have been concussed and are having lingering symptoms. So first off, 500,000 kids a year go to the ER for sports-related concussions. So that's not even people that are just rolling downstairs, young people just getting into skirmishes or whatever, tripping and slipping on the ice. This is just in sports, 500,000 a year in this country. So we have a significant problem. And if anybody has had their kids in sports, it's like a nightmare when your child sustains any level of concussion, because it's really hard to say, when are they ready to play again? So we rely on our professionals. And by no means is this podcast designed to help you be the sole diagnostician or treating physician for your child or for anybody but it just gives you a nice summary. So if you ever suspect that someone has had a concussion, you seek immediate medical care, because they can be deadly, seriously deadly serious, and they can also be very subtle and hard to figure out. So hopefully we'll go over that today. Start out by saying that a definition for concussion. One definition is a disruption of the brain and connective tissue that supports the brain, leading to damage, symptomatic neurological symptoms of the brain. So what does that mean? So you're going to have, many issues that are neurological, and we'll go over the symptom complexes and how subtle some of them can be. Another definition is a physical, cognitive, or emotional symptom complex following a blow to the head, right? So there's something involved in the person's emotions, possibly their thinking process, their memory, short-term memory, that kind of thing. The brain weighs about 3 pounds, and as most of you know, it's inside the skull, and the skull is a pretty good bony box. To support it, it's also then supported by ligaments, different wrappings that hold the brain sort of in the center so it doesn't bounce easily off the skull. And that's part of what a concussion is, a force applied where the brain actually moves inside the skull and bounces around or pulls or tears at the supporting membranes, causing swelling. That swelling leads to pressure. And you can also have actually, damage to the neurons themselves. So you can have pressure from swelling from torn tissue, or you can have actually the neurons, the brain tissue itself can be partially torn or injured or swollen or bruised. All those things lead to changes neurologically in the person, from the emotional to the physical. A neck injury can occur with 4 to 5 or 4.5 G-forces. So that's kind of a smaller force, right? Compare that, a head injury takes 70 to 120 G-force to create that, which is times gravity. 1 G is 1 times gravity. So it's a significant amount of force to get a concussion, but an elbow to the head can do that easily. My daughters play volleyball. A volleyball to the head hit by a pretty skillful player can cause a concussion, and volleyball is pretty soft. But traveling at that speed, it can create a pretty significant concussion. So let's look at the categories. We have sort of mild, moderate, and severe, typical classification system. Now in mild, we're talking about a known blow to the head, let's say, and then about a 15-minute window, and everything seems to go away. So the person feels a little dazed and it knows that they were hit. So they might be walking around a little bit, disoriented. And within 15 minutes, everything's gone. So that'd be a mild concussion, because they did have there for a short time a disruption of their here and now, in a sense. Now, moderate concussion is something that lasts more than 15 minutes. It's still, you did not lose consciousness. That's the big category. The mild and moderate, you stay conscious the entire time. You know where you are, everything is fine, but you're just that mild sort of removed from the area type of feeling. Now, a severe concussion means loss of consciousness, and that could be for 2 seconds. Sometimes it's 20 minutes. If you've ever seen a football game where the poor player's laying there and you can tell that they really are not moving and they've had a good strike to the head, that is a severe concussion. They're out and then they come back. So it could be for seconds you lose consciousness or not, but that's going to be severe. And each of those are going to carry with them a lot more complex symptomatology, deeper, longer lasting symptoms. So let's just go over some of the simple symptoms that you can have with even a mild, moderate, or severe concussion. First off, a cut or a swelling to the outside of the head. So somebody is hit by something and you can actually see visually, some bleeding, a cut, or a good old-fashioned egg on your head, a bump, a swelling from the trauma to the skull. That implies that you were hit hard enough to damage the outside and potentially the inside. A headache, light and sound sensitivity. So the person's saying that I really don't want to be around these bright lights. Everything seems loud. I just want to stay away from those kind of sounds. Something like that. Irritability. People become severely depressed. If you've seen some of the reports on especially football players over time, they end up with depression issues, anxiety, suicidal thoughts, all that kind of stuff. But right away, we're looking at irritation in the immediacy. Confusion, of course. They're easily upset and confused and they're not sure what's going on. Dizziness and lightheadedness makes sense, right? Balance issues. Someone seems a little bit off on their feet, and everyone has seen the staggering boxer who's been punched so many times he's staggering around the ring, but nothing, not even that severe, just someone who might even report, I just don't feel like I have my feet under me. I feel like I wobble a fair amount, that kind of thing. Nausea, certainly vomiting. Memory issues. They're saying basically, what was it again? They can't remember simple things. Even if you can give them a list of 5 things, say it to them and have them repeat it back, and they can't get through the list, right? Significant. Blurred vision, because the eyes are, obviously, and the neurology of the eye is back into the skull. Swellings can cause changes in people's ability to focus and see. Ringing in the ears, right? Because you've stunned the neurology and the ear is inside the skull as well. And it starts to ring because the little muscles and bones in the ear are actually in a spasm from the trauma. And fatigue, right? So a person's just exhausted and they're just tired and that kind of thing. But, for all these, we want to see, a professional at first, and then we want to get into, like I'm going to do in a minute, some of the treatments we can do, because some of the times it's sort of a wait and see approach. You'll go to the ER, you'll go to your primary, and they'll run, and you may have some of these symptoms, and they'll categorize you as mild, moderate, let's say. But you still want to get immediately, you want to start treatment on these things. And that's what I found interesting. Within 2 or 3 days, the therapeutic window or the effect of certain therapies starts to go down. So you want to get on them day one. Immediately, you want to start doing very simple things, nothing really rough. Most concussions on average, though, last 5 to 7 days. So a mild concussion can still last some of those symptoms for 5 to 7 days. Kids are a little more prone to concussions. And the reason is the brain is covered and the neurons are covered in myelin. It's like an insulator on a wire. And that myelination process occurs slowly over time. So a child isn't fully myelinated or insulated within their neurons. And when they're damaged, that myelin actually helps protect the brain. So the brain is much more easily damaged without that insulation over the wiring, in a sense. And the circulation within that is also diminished a little. So children tend to inflame a lot. So then you have the pressure of swelling of the brain, and you also have a lack of protection for the nervous tissue itself. So we want to make sure that we're paying special attention to kids a little bit younger. So how do we heal it? How do we heal a brain? There's many things. Obviously rest. In the beginning, concussions were they called it like a cocoon approach. So they said, okay, let's go with a moderate concussion. Well, the child or individual is put into a dark room and told to sleep it out. Right. Well, once they're diagnosed, that a day or 2 goes by and they keep an eye on them. And so get a lot of sleep, and just stay in the dark and don't read anything. Don't use your eyes. Just, sit in this sort of cocoon and heal. Well, it turns out research has shown that isn't the best strategy. That might be something comfortable for the person, but some stimuli is important. So you want the child or the individual to walk, to do some reading, to get some light in their eyes. And what you're looking there is a little bit of symptom enhancement. Like say a person has a headache, it elevates a little bit, then you put them back into a darker and less stimulating area and it fades away. Well, that's great. Then you can get started again. So you keep toying with the idea of irritating the symptomatology very mildly. So walking is great. You'd never ride a bike, right? I mean, you have a concussion. You don't want to be doing anything that could risk another head trauma. Of course, they're out of that sport, for example, and they're going to do very gentle things, no fast moving things, nothing that involves, heavy coordination. You're not going to, go for a sprint. There are some sources I looked at that they said running was okay, but obviously what you're doing here is you're starting slow. You're being very cautious, but you are paying respect to the idea that circulation to the brain is important. And one of the things that we know is that neck movement enhances circulation to the brain. As a chiropractor, we've seen studies, I've read many studies about how cervical adjustments enhance blood flow to the brain. And I have patients that after I adjust them will say, I feel like you opened up my brain. And it's interesting to hear that because then they feel like they're getting sort of a blood rush or a cognitive enhancement from an adjustment, which I think is very valid because the physiology and the reports have shown, Doppler studies have shown enhancements in blood supply to the brain with, stimulus to the neck, whether it be a chiropractic adjustment, heavy stretching, and as you know, chiropractic adjustments are going to be more enhancing because they're deeper than a simple stretch, although still very valuable. So walking, neck exercises, stretching of the neck, and of course ice. Ice is nature's anti-inflammatory, very safe. 15 minutes of ice at the base of the neck is some of the recommendations that I found in researching this, done 5 times a day because, you think about injuries and how inflammatory they are. And if we can ice the base of the neck, we can get some temperature variations back into the skull a little bit. And as you know, a lot of people will ice the egg on their head and they bump their head and keep that manageable, which is also, very important. Brain circulation is enhanced in many ways. Deep breathing exercises, of course, right? We're going to breathe through our nose. We make nitric oxide when we breathe through our nose. Nitric oxide is one of the most healing chemicals in our body. So we want to make sure that we're doing movement and breath. You can do them at the same time. You can breathe as you stretch the neck from side to side, and in rotation are the most effective ways. So number 2, diet, right? So diet, I always go to a very similar diet, a diet that is not inflammatory, something that brings down the swelling. I have, I take out the dairy products and the gluten and all the processed foods and alcohol, of course, and drink a gallon of water, get a lot of vegetables, nice different color on the plate. Like I've said before, eat the rainbow, and lean meats. So we want enough protein and all the phytonutrient contents found in vegetables. We want to be strict, right? I mean, you think of Tom Brady, apologize to all the Bills fans for bringing his name up, but Tom Brady has this immaculate anti-inflammatory diet. It's in his book, and it's pretty amazing. It's one of the many reasons he's still in the NFL. I feel I respected the diet that he's on, and you definitely want that kind of diet with a brain trauma. I'm sure that's some of the reason he's on that, because as his wife admitted one time, he's had a couple concussions and they weren't well advertised because it's a lot of money and they wanted to play, I'm sure. So we cut out the dairy products, cut out the gluten, and we cut out the processed foods. We eat as many vegetables, nothing new under the sun there, but there's the time to do it. Okay. Maybe you can't do that, your whole life, but you certainly can do it for a couple of weeks as you're healing your concussion. Supplements and treatments. Interesting enough, the cold laser, there's some real evidence that a cold laser placed over the skull in different areas where the trauma was, sometimes where the pain is, has released nitric oxide and caused them, like a bringing anti-inflammatory approach. So we can get that very focal cold laser treatment. So you can look into that. Brain-derived neurotropic factor, BDNF, is what is produced as well. Now that is something that is related to a heat shock protein, which comes from people going into saunas. Now I could find no evidence that a sauna was a good idea for someone with a concussion. It's kind of stressful, so I'm not recommending that. But I would say that if you can create those same brain peptides using cold laser, that sounds like a great idea, because you're going to be able to bring down the swelling and, once again, speed the healing, enhance the circulation. I mentioned before neck exercises. So you want rotation mainly, and you want to do the count of 100. So you count each way. So that's 1, you go back, 2, right, till you get to 100. That kind of rotation pumps blood, lymph, even cerebrospinal fluid at a higher rate through and around the brain. Realize that our brain is not just sitting in a set of ligaments. There's a fluid membrane that holds the cerebral spinal fluid that helps to give nutrition to our brain, and it's a watery protection as well. And that pumps at a very slow rate. So if you can enhance the rate of that, you're going to enhance the circulation to the brain. So rotation is a great way of doing that. And that happens obviously with chiropractic care as well. Vitamin D, one of my favorites. It promotes healing and brings down inflammation. Vitamin D, I can go on for a month on that stuff. It's crucial. Think about it, it comes from the sun. The sun's the universal source of all life and energy on this planet. So I think we should pay respect to the idea that, we might not be green plants, but we do need the sun to be truly healthy. So whether you take it by a supplement or get some sunshine on your skin, that's a very important nutrient during concussion. Fish oil, well, fatty acids, the brain is made up of some fats, and supplying it with the right fatty acids. The omega-3s are the healthy fats. Everyone knows fish oil. Chia seeds have omega-3s in them. Krill oil, something a little more powerful than a fish oil actually, are great fats to be taking during brain injury to enhance neurology and get that healing to occur. We really want all the inflammatory agents down in there. Some of the results, some of the detriments of concussion are actual brain damage. The others are just plain inflammation, putting pressure on the brain, leading to a problem. Glutathione and magnesium. Magnesium L-threonate is the best one. There's many forms of magnesium. Magnesium is a charged, it's an ion in a sense, it's a charged mineral, so it needs to be attached to something to be stable. And we digest that off and use that magnesium, but it increases enzyme functions. Minerals are cofactors for enzymatic reactions, and enzymes drive our whole physiology. If you just shut down all the enzymes in your body, you'd simply drop over dead. So you need enzymes to you need minerals to maximize your enzymatic activity. Enzymes will heal you. So we want to make sure magnesium, one of the most, probably the single most deficient mineral in human physiology right now. The essential fats, vitamin D, minerals, they're all in here for this, mainly because they are very deficient in most of us. It's hard to get these things from our food only, probably because the way we grow it and the soil that it's grown in, all that kind of stuff. Curcumin. Now, if you cook with turmeric at all, or turmeric, I don't know how that's pronounced, I say in both ways, you will release some curcumin from that. So one of the recipes I have for people is to put a little bit of coconut oil in a pan, heat it up, put some turmeric in there and some black pepper. And when you cook that on a medium flame for about 3 minutes, it heats up and you release the curcumin. Then you can just throw in vegetables. You can scramble eggs in there. You're putting food in there and then eating it live and freshly released. Also, you buy curcumin as a supplement. I sell it out of the office all the time because so many people come in with injuries to their entire body, and curcumin and turmeric work well for that. But if you just took turmeric, there's some benefit, but you want to get that curcumin out of the turmeric. Heating that up does that, or buying it separately as a supplement does that. Boswellia increases cognitive function. So that's an herb that has been shown to enhance some of the cognitive neuro relationships between the neurons, the conduction ability, the neurotransmission. Helps with neurotransmitters, the chemicals that actually help us talk one nerve to another. And creatinine. Creatinine is a brain food. So creatinine is something where you can give the brain the nutrients it needs to help with cognitive functions, to be able to get all the mitochondria, which most of us know, as studied some basic science, is the energy source, the energy organelle inside a cell that produces ATP. Remember I think that's probably middle school science, to be able to have energy. Because as you see from the symptom list, we have people that are very fatigued during concussion. They have issues that are ongoing. So the sooner you treat a concussion, the better. The sooner you get it analyzed to make sure that it's not severe and that you may need medical intervention that's pretty significant, the better. You know, these concussion protocols they've come up with in sports are fantastic. We're being a little more careful with people to save their brains, because this stuff doesn't just happen and then go away and never come back. There is, as you may see, if you read enough articles on some of our athletes, once they get a significant concussion or a severe concussion, they're never the same. They cannot sustain a second one very well. They get a second one much easier. So it'd be less of a trauma, and the neurological symptoms are worse than it should be for the low level of trauma that they had. And in that movie, Concussion, you've seen the long-term detriments. People over time, but 20 years after playing football, have significant problems with their cognitive function, their emotions, and such. So we want to treat concussions immediately. You can tell, once again, it's about inflammation. It's about bringing on the healing through a lot of circulation. So getting a gallon of water in your body has also been shown to make a difference, right? So you're going to get enough fluid to dilute out and to create a nice pressure gradient so the nutrients can get to the area. Imagine if you're dehydrated, you may not have enough cerebrospinal fluid to really pump with any volume around the brain, and your blood is going to be a little thicker. It's not going to get to the nooks and crannies. So by having the water and then the anti-inflammatory nutrients, cutting out the bad foods, the processed chemicals that we all have to detoxify from when we eat those kind of foods, you're going to have a clean system, and you're going to go right to work healing. I always talk about healing like you have this window and then the cement kind of dries, right? You can carve your initials in wet cement. You can change things when they're young and when they're new. But once they're in there, it's much more difficult. So we want to heal that brain, and we don't want it to be further damaged by sustained pressures. The longer you have inflammation in the skull, the longer the pressure sits on the brain, the more neurons actually die. And then you have to reteach other parts of your brain to make up for that. And that's very difficult, especially as you're older, to reteach. The old dog, new trick kind of thing fits in there a little bit. But with kids, because that myelin isn't developed, we want to make sure that we get after it immediately. So, right away, immediate medical treatment, medical care to assess the level of the concussion, and then get into, the proper rest, but enough stimuli, the proper diet, enough water, and then some of these herbals and the cold laser chiropractic care, neck exercises, all to bring down the swelling. So in the end, we have, very solid healing going on, because there's a lot we can do with concussion. It's not like it used to be. We have so much more information now from all the research that's been going on over the years. So, hey, if you like these videos, give them a thumb up, subscribe to the channel, and, we'll keep these things coming. So get going on your concussion studies. You can look all this up. We'll put some stuff in the link so you can further research this, and have a great day. Thanks.